Good day! We are the researchers from Group 1A, Section C, and we are here to present our research study on the level of perception of student nurses towards online learning. I am Isaiah Aragon, the group leader, and my group members are Laika Abendan, Alaysa Alonso, Ali Arima, Wala Basa, and Therese Bugay.
Background of the study. As technology advances, studying and learning are also adapting. Online education is another way to help students engage with the learning process. As schools try to meet the requirements of the new normal education setup, online learning becomes a crucial part of that standard. However, its quality has become a major concern to students and educators. Online classes in Bacolod City started last August 17, 2020. The school university took advantage of online platforms such as Zoom, Canvas, Facebook Messenger, Google Classrooms, and many more. This study was conducted to determine the different level of perception of student nurses towards online learning. This shall serve as a tool in providing the students and educators a guide about online learning. The researchers pursue this topic because it gave it interest since they're also involved in this new education setup. Statement of the problem. This research was done to determine the level of perception of student nurses towards online learning. Specifically, it aimed to answer the following question. What is the demographic profile of student nurses in terms of age, sex, and year level? What are the level of perception of student nurses towards using online platforms when categorized according to internal and external variables? What are the perceived benefits of student nurses when it comes to online learning? And is there a significant difference in the level of perception of students with their group according to age, sex, and year level? Hypothesis. There is no significant difference in the level of perception of student nurses towards online learning when they are grouped according to age, sex, and year level.
The significance of the study. The results of the study may be beneficial to the following. The administration. The information acquired from this study may help resolve present issues in the system. This will also further enhance knowledge and understanding about online learning. College of Nursing faculty may be able to empathize with the students who are also adjusting and adapting to online learning. The study may also serve as basis for faculty to conduct effective learning approach. The study is also beneficial to student nurses since their education is at risk. This study may help them to be enlightened regarding the complications of online learning to skill-based courses. To the parents of the student nurses, this may enhance their understanding as to whether they are getting their money's worth through their child's education. Lastly, the study may help future researchers who also plan to delve into the study. They may modify and revise information and results in the study. The study was anchored by the experiential theory proposed by psychologist David Kolb in 1994, in which he defined learning as a process where knowledge is created through transformation of experience. The theory takes a more holistic approach and gives emphasis on how experiences, including cognition, environment, and emotions, affect the learning process. With the experiential theory as guide, researchers have constructed a schematic diagram that shows three variables that contribute to the level of perception. These are the demographic profile, the age, sex, and gear level, the internal variables, which includes the knowledge gained from past learning experiences, self-efficacy, and learning styles. With external variables, we have the availability of devices, connectivity status, and the geographical location. These variables contribute to the level of perception of student nurses towards online learning.
Research design. This study made use of the quantitative descriptive research design. A researchers made survey questionnaire was used primarily to obtain data on the level of perception of student nurses. The researchers used internet platforms such as Google Forms for collecting survey results. A total of 213 student nurses were selected. Participants of the study. Participants of the study were student nurses from Bacolod City enrolled in the first semester of the academic year 2020 to 2021. There were 277 second-year students and 179 from the third year. There were 456 students in total. Sample size was determined by the using of Slovin's formula, and the total of 213 participants was selected. Stratified random sampling was used to identify the distribution of samples from both year levels. Instrument validity and reliability. The instrument used in the study was researchers' made. To ensure the validity of the questionnaire, the researchers used the Good and Skates validity test, which showed a rating of 3.5, which interprets as very good. There were also 3 validators coming from the College of Nursing faculty from Bacolod City. To test the reliability, the researchers utilized the convex alpha test, which results of 0.8, which means that the instrument was reliable. The standard score must be within 0.7 to 1.0.
Data gathering procedure. Prior to the conduction of the research, the researchers asked for the permission and approval of the Dean of the College of Nursing. Upon approval, the researchers determined the participants using stratified random sampling and sample size using Slovin formula. Our researchers made questionnaire was given through Google survey forms. Data collected was analyzed by tallying, taking note, and recording the number of participants who answered the question. Statistical treatment. Researchers used different descriptive and inferential statistical tools to answer the objectives of the study. The tools utilized were mean, standard deviation, and frequency distribution values among the first, second, and third objective. Independent samples t-test was used in order to assess the fourth objective and the hypothesis of the study, which is to investigate whether there is a significant difference in the level of perception of student nurses. Ethical considerations. Researchers will observe confidentiality and recognize ethical considerations in all phases during the conduct of the study. Principle of non-maleficence. Conduction of the research should not purposely inflict harm. Principle of autonomy. Researchers should obtain full consent of the participants prior to the conduction of the study. Principle of justice. Researchers should ensure the protection of the privacy of the participants. Principle of beneficence. Researchers secured any information gathered during the collecting of data. All data and information will be disposed properly after 2 years to secure confidentiality and protection of the participants.
Results and discussion. Table 1. Demographic profile. The percentage of 70.4%. Results show that the majority of the participants are female student nurses who participated participated in the study. For age, the participants are within the age bracket of 18 to 20 years old. This indicates that there is a variety and that they are of age. For the year level, there is a higher percentage of third-year student nurses who participated with a percentage of 50.2%. These are the students who has experienced face-to-face and online classes as well as face-to-face and online clinical exposure. Table 2. Internal variables. For self-efficacy, there is a high perception mean of 2.80, improving their self-efficacy when it comes to their academic tasks. For knowledge gained from past learning experience, there is a low perception mean of 2.49 and the improvement in the acquisition of knowledge during online classes. For learning styles, participated has a low perception mean of 2.01 and the improvement of their learning styles and habits during online classes. Table 3. External variables. For availability of the devices, 59.9 answered that they use laptops, desktops for online classes. For internet connectivity, 47.6% belongs to category 2B, which is limited internet connectivity. For geographical location, 58.5% reside within Bacolod City. It is a highly urbanized city with access to internet. Although there is accessibility, the connection is limited.
Table 4. Perceived benefits. The researchers chose top 3 among 8 questions. The highest is a mean of 2.92, which interprets as a high level of perception that online classes has provided the students sufficient time for them to finish their academic tasks. Next is a mean of 2.88, which interprets as a high level of perception that the students achieved higher grades during online classes. The lowest is a mean of 1.75, which interprets as a very low level of perception as to whether they are not easily distracted during online classes. Table 5. Significant difference. The results show that ages 18 to 20 years old have a significantly higher level of perception compared to 21 years old and above. Male student nurses have significantly higher level of perception compared to female student nurses, and second years have higher level of perception compared to the third years. Therefore, there is a significant difference in the level of perception of student nurses towards online learning when grouped according to age, sex, and year level. Conclusion. This research explores how and when online instruction is most effective. The demographic profile presented that majority of the participants are female, belongs to the 18 to 20 years old age group, and are in the level 3. In conclusion, for internal variables, majority proved their self-efficacy by giving out quality outputs and effectively performing their academic tasks. There is no improvement in the acquisition of knowledge during online classes. Their learning habits and styles are better during traditional classes. For external variables, laptops and desktop are the most utilized device for online classes. Majority of the participants reside within Bacolod and belongs to category 2B, which indicates having limited internet connectivity. For perceived benefits, student nurses were provided sufficient time to finish their academic task and are achieving higher grades in online classes. As for significant difference, age group of 18 to 20 years old have a higher level of perception compared to 21 years old and above. Male students also have higher level of perception compared to females, and second years have higher level of perception compared to the third years. Therefore, the level of perception of student nurses towards online learning varies according to age, sex, and year level. This implies that the hypothesis is rejected.
For the recommendations, the findings and conclusion of the study have implied some recommendations that can be addressed to the participants and stakeholders. To the administrators, faculty, and staff, the researchers recommend for them to provide flexible learning activities during synchronous and asynchronous meetings, since majority has limited internet connection. To the student nurses, it is recommended to clear guidelines and preparation prior to starting any online program. It is recommended for them to have better time management in doing other tasks. It is also recommended for them to find a place inside their homes that is inclusive for learning. To the future researchers, it is recommended for them to do further studies regarding this research. To CHED, it is recommended for them to have improvements on this new learning platform that can provide practical skills and knowledge, especially to skill-based courses. And to the institution, it is recommended to allocate a budget to provide pocket Wi-Fis, especially to those students with low or limited connectivity.
Utilization. The study results were relayed to the College of Nursing faculty, to participants who wish to know the results, and endorse the school administration upon completion as a basis for future improvements. The data will also be available to serve as a basis for further studies to improve this new learning platform and to establish trainings or seminars to the faculty regarding online education. References. These are the references used in the study.
Acknowledgements. The researchers would like to express their gratitude to those people who have been instruments in the accomplishment of this research study. To Dean Ivy G. Idimni, RN-MN, Dean of the College of Nursing, for upholding academic excellence in all areas of learning and for allowing the researchers to conduct the research study. To Dr. Sheila M. Trajera, RN-MN, PhD, and Dr. Leslie E. Young, RN-MN, PhD, research professors, for the knowledge they imparted to the researchers and for the support and guidance throughout the study. They have been a crucial part in the researchers' understanding of the research study. To the research panel members, for their shared time and effort in giving their critique on the research paper and for the insight they have imparted to the researchers. To the faculty members who served as validators of the study, for accepting the request to be part of the research study. The researchers would also like to thank these people for their guidance and support throughout the study. And lastly, to the families of the researchers for giving them the opportunity to have the best quality education, for their support and guidance throughout their studies. They served as inspiration for the researchers to accomplish their goals. That's it for our research study. Thank you for listening.